Hi, everybody. This is Dr. Thomas Wright, and I'm going to talk about lipedema reduction surgery. This is one of the most important treatment options for women with lipedema, and the history is very interesting. Sit tight. So lipedema was first described by two vascular medicine physicians, Dr. Allen and Hines, and at the time, the only treatment offered was compression. In the late 1980s, Dr. Jeffrey Klein developed a tumescent liposuction technique. And in 1992, Dr. Gerhard Sattler, also a dermatologist, spent time with Dr. Klein learning the tumescent liposuction technique. Dr. Sattler then shared this training with Dr. Stefan Rapprich and others in his dermatology circle. They first started was just cosmetic liposuction, but so in Europe, the dermatologists are venous and lymphatic specialists. Here in the United States, they're mostly separated. There are some dermatologists that do focus on venous and lymphatic medicine, but most of them are actually from a different specialty here in the United States. But anyways, in Dr. Rapprich's clinic, he would see women with lipedema. And he had a patient that had lipedema. She tried the compression and had gotten almost no relief of her pain. So she reported to him she had nothing to lose and convinced him to start doing liposuction to reduce her lipedema pain. Well, she had a great response, and this encouraged him to do more, and his colleagues to do more. He first published the results of this surgical reduction of lipedema at the Paris Dermatology Conference. So more dermatologists and lymphologists started treating lipedema surgically. And this was followed by many more publications. Dr. Sattler published, Dr. Schmeller, Dr. Cornely, and Dr. Stokes all contributed to the early publications and early treatment of lipedema with lipedema reduction. Well, very shortly, there was a backlash. So the lymphologists, led by Dr. Michael Foldy, based on their clinical experiences of patients who had lymphedema that was caused by liposuction. So he wrote in his textbook that surgical reduction, lipectomy, can cause lymphedema as a complication. And he went on to explain that, the concerns about the major collecting ducts, the ventromedial lymph bundle, etc. And finished that lymphedema is much more serious than lipedema. People don't die of it. And, so really showed some great concerns about doing this lipedema reduction surgery. He even mentioned that liposuction can result in death by fat embolism. There's also the experimental surgical lipedema, and this is one of the main models used to study lymphedema in lab. And this is a mouse tail model, and basically simply interrupting those lymphatic collecting ducts leads to the development of lymphedema in mice. And they study the tissue. Widely, much of our knowledge is based on this model. Well, other specialties react. There's heated debates in medical meetings. I mean, these dermatologists and lymphologists were called dangerous charlatans, killers of lymphatics was shouted at meetings. Some of these, so some of their colleagues, lymphologists, plastic surgeons, were very, voiced very strong concerns about this lipedema surgery. Well, this back to the drawing board. There was anatomist Eric Brenner did beautiful anatomy studies or careful dissections of the lymphatic anatomy. There was also studies with lymphocinograms and direct lymphography before and after. And then Hoffman and Baumeister, they did some lymphatic dye studies and cadaver studies. And this and they showed that this longitudinal technique was less traumatic and how important the tumescent was. So in 2008, Dr. Håkan Borson, he's one of the pioneers of lymphedema surgery, and he was the first plastic surgeon to treat lipedema. And about 6 to 8 years later, plastic surgeons in the U.S. Joined the dermatology and lymphatic specialists and began treating lipedema. So over the years, between 2007 and 2018, there was growing evidence from many publications that lipedema reduction surgery, this lymphatic sparing liposuction, was leading to decreased pain, decreased need for compression, decreased swelling, and increased quality of life. In 2021, Baumgartner published in a phlebology journal the long-term outcomes of 60 patients he treated with lipedema surgery using the previously validated longitudinal cannula strokes and tumescent, what we call lymphatic sparing techniques. Yet lymphatic injury still occurs. Dr. Herbst and I published a series of women with lipedema who experienced lymphatic injury after liposuction. This lady, as you can see, her developed lifelong lymphedema after. So in 2023, last year, a publication in PRS Global Open, I using the identical techniques pioneered by Dr. Rapprich, I showed that the lipedema reduction can improve mobility measures. And these mobility measures are correlated with decreased disability and increased life expectancy, the specific measures I looked at. So in summary, careful technique and experience are important factors in treating lipedema surgery. The longitudinal cannula technique and tumescent techniques have been validated by dermatologists and lymphatic specialists to be safe and effective. Evidence for the effectiveness and benefits have grown exponentially over the years. And as the evidence has grown, new specialties have joined the core specialties in treating lipedema surgically. These newer specialties, like plastic surgeons, have brought more varied surgical techniques. There is much less evidence for the safety and effectiveness of these new surgical techniques. But hopefully there will be evidence will be coming in the future. Thank you very much for your attention. Hope this was helpful. And this is some of the uh, dermatology publications, dermatology and phlebology publications supporting the safety and effectiveness of the lipedema reduction surgery.